Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Abbie Goodman and Dr. Natalie Meyerhofer, the fun 2-woman team at Inspire Family Chiropractic in Appleton, Wisconsin. Before we jump into today's episode, we wanted to share a little bit about each of them. Dr. Abbie grew up in Appleton, attended UW-Eau Claire for her undergraduate degree, and then went on to complete her schooling at Northwestern Health Sciences for chiropractic. In 2017, she ventured into business ownership and opened the doors to Inspire Family Chiropractic. While she loves providing chiropractic care for the entire family, she has focused trainings, certifications, and passions for the prenatal and pediatric populations. Dr. Abbie loves spending time in the yellow sunshine, enjoying yummy food and coffee, camping, hiking, traveling, and spending time with her husband and 2 young kids. Dr. Natalie grew up in Iola, Wisconsin, and now lives in Kaukauna with her husband and 1-year-old son. Because her mom was a chiropractor, Natalie was blessed to be able to witness the miracles of chiropractic from a young age. Dr. Natalie attended UW-La Crosse for her undergraduate degree before heading to Minnesota to finish chiropractic school, and during her schooling, she discovered a passion for prenatal, pediatric, and family wellness chiropractic. In 2021, Natalie lost her mom to ALS, and now she has found the best way to remember and honor her is to provide the same care and dedication that she showed her patients every day. These 2 ladies are a breath of fresh air and literally radiate sunshine themselves, which is why we know you're not only going to find these 4 episodes with Abbie and Natalie educational, but also incredibly fun to listen to. It's time to turn up your volume and let's get started with today's conversation.
Hey guys, welcome back to the podcast. We are here with Dr. Abbie and Dr. Natalie. We're so excited to have you guys back here.
Yeah, thank you.
We are going to be talking about the nervous system and stress with this episode. I think we're going to be very interesting as we're chit-chatting here about these things and how you guys really focus on them, particularly in your practice. But before we get into that, kind of just tell us your specialties and how did you choose it? Why is what your specialty is important?
Yeah. So at our office, we specialize with pediatric prenatal chiropractic. We do see the whole family as a whole unit because obviously we thrive as families. But we have specific training with the prenatal world and prenatal and pediatric world.
Yeah. So, but you see postpartum, you see toddlers, kids.
Absolutely.
Men.
Yes.
Yeah.
Yep. So stardom, preconception all the way through, and treating that whole group.
Yeah.
Mm-hmm.
And so you enjoy doing that because this is just a specialty that you've really particularly delved into, right? So based on your own experiences and that sort of thing. And if you want to learn more about their story, definitely listen to episode 1. We talked a lot about that. It was really interesting. So how does chiropractic work and what kind of approach do you take? How are you different than other chiropractors?
It's a really great question. It's like a loaded question.
It is a loaded question.
So chiropractic, I feel like a really easy way to explain it is all about your nervous system, right? So you probably hear that a lot when people talk chiropractic is like, oh, my nervous system is this, my nervous system is that.
Well, but even just to, I feel like a lot of people are like, you're here to make sure my spine is in alignment. It's more about joints and bones than even nervous system.
Yeah,
so I
so
feel
we're
like
gonna
even
take it
you
one
just
step
saying
further.
that, right, is almost a light bulb for some people.
Yeah.
So go ahead.
So nervous system, you have your brain and your spinal cord, right? That is like what runs everything. And your brain is in constant contact to your body via your spinal cord. So like all the signals get sent down there. Think of it like a highway, right? Like signals are constantly going out, and then your body, as it's doing everything, needs to talk back up to the brain to keep everything working. So like there's always stuff going out, always stuff coming back in. And so chiropractic really focuses on basically keeping that communication flowing and at 100% so that everything is working how it's supposed to. And then that's why patients start walking through our doors, is because something's not working how it's supposed to. And that's kind of our job, is to find the area where the miscommunication's happening, fix it, and then get everything back to 100%.
Do you typically find people coming into your door because of like injuries and I have an ache or a pain here? Is that typically their first step?
Definitely. We definitely have some that do. I feel like it's transitioning a little bit more as society's just understanding chiropractic a lot better, truly, than just the aches and pains. We absolutely can help with aches and pains.
Right.
It's part of the body communicating and telling us that something isn't of ease of flow from brain to body. But I would say lately it's more of
Think like wellness care.
Yeah.
People are being more proactive.
They
Proactive.
are.
I'm
It's
really happy
great
to hear
see.
that.
Yes.
Yeah.
Yeah.
So people are coming to you. They're like, I just want to get my body aligned. I know this is good for me. Tell me why. I'm
Truly.
here. Let's do it.
Yeah,
That's
absolutely.
fantastic.
And what's really cool too is with those really young ones, when they're coming in, a lot of moms are knowing that, okay, I've heard that someone else, one of my friends, one of my people from church are bringing their baby to the chiropractor right away. Like maybe I should too. And then what's really cool is, since we are neurologically focused at our office, we can show them, without baby obviously being able to tell mom, am I in full communication? We can show them with the scans that we get to do at our office if they are truly in full ease flow of brain to body, body to brain.
So you said neurologically focused.
Yeah.
Are other chiropractors, do they have a different approach than how you just described it?
Yeah, there's many approaches within the chiropractic profession, which is really great because it truly is a great gift for the body to be able to just do all the things it's supposed to do on its own. But with our focus on the nervous system itself, we're truly trying to dig into what's like the true onset of these signs and symptoms that can come up in our body. So even if you're in for wellness care, our patients are coming in and talking to us about, this week, I noticed I had like a really bloated stomach, and then we'll talk about that, and we'll look into their system a little bit more of where could that be coming from on a nervous system base versus just where that pain is. Okay, we'll adjust in that zone.
Okay, so when it comes to nervous system, I want to get a little sciencey here.
Yeah.
I mean, high level sciencey. But when you're actually adjusting someone, are you simply making sure that like the nervous system is in alignment with where it should be in the body so that that information can flow well? Or like when you are doing adjustments, is it almost like sending little shock waves to the nervous system that help in different ways, whether it's like waking up things or detoxing things, or like what is actually happening when you're adjusting?
Mm-hmm. So we're obviously adjusting the joints, right? Like your spine is what protects your nervous system essentially. So like when we're doing the adjustment, what the people feel like when you're getting adjusted is your joints moving, right? Or the sounds coming from your joints or whatever it is. But what's really happening at that deeper level is like, yes, like you said, Britt, like the signals are going straight into that nervous system and helping, remove stress or tension or pressure or whatever is going on in that area to help with that flow.
Yeah. Yep. Making it ease.
Yes.
Through the whole system.
Yep.
Okay, so stress specifically, is stress something physical that shows up in the body that can be like flushed, or is it more of a mental piece? Or like how do you see stress? How do you guys, when you're doing a physical adjustment, help with something that a lot of people would think is more of a mental game?
Yeah. With our first visit, we talk about the 4 T's of chiropractic and of stress. So the 4 T's are broken down into trauma, which is anything physical that our body's adapting to. Thoughts, which is anything mentally, emotionally, spiritually that we're constantly adapting to as well. Toxins, which is chemical. So that would be like hormonal balancing, all the food that we're putting in our body, everything environmentally, allergies, all that thing, all of that is toxin. And then technology is our new T that we get to throw in because we're always being kind of our brains bombarding and adapting to those different waves of technology. So the 4 T's is really stress. And stress isn't bad. It's just part of everyday life, but it's how well our body can adapt and understand the changing of each stressor as it comes and goes through our system. So if we're not adapting well and our body's kind of more in a distress because it's being bombarded with too much, that's where chiropractic is beautifully woven in to kind of release that stress from the system.
Okay. And then you offer different scans in your office, right? So do those scans help to show you like where stress is being held, things like that? Why don't you walk through the different scans that you offer and what they actually do?
Yeah, cool.
So we do 3 different ones.
Yep.
3 different scans. The first one is called a rolling thermal scan. So thermal is heat. So it's literally we take a little roller, we roll it right up their spine. And basically it takes both sides of the spine into account, and it takes measurements of heat on both sides. And then it will show us little bars at like each spot. And then each bar has like a color for how hot it is. And we like to call those like our hot spots. So there's white, I think it goes green, blue, and then red. So red is like the highest amount of temperature, right? It's like, this is a hot spot. This is where we really want to be
Like
looking.
inflammation.
Yep, stress, anything going on in that area. So then we can literally take that picture, show the patients and be like, oh, like let's just say, for example, right up here at your cervical spine, we've got a lot of red. And then we kind of like correlate that back into, is it muscles? Is it tissue? Is it organs? Is it glands?
Yes.
Like what's happening in your life? What's happening? What kind of symptoms do you have? And most people, when they look at that, they're like, oh yeah, that makes sense.
Yeah.
Like, that is me.
For
Yes.
sure. The thermal is what we call the functional scan too. So it's more of like, how is your overall functioning going on in the system itself? And that's why everyone's like, oh, those signs and symptoms correlate to this level of the spine. And that's where like it truly can go hand in hand with symptomatology, but then also the functionality of that nerve in that zone. In comparison, then, the second scan that we do is called surface EMG. This one is taking more of that muscle electrical impulse that the brain sends through that nervous system to tell the muscle to contract. So it tells us how much your body's working on a structural level, muscle, nerve, joint, to hold you in a nice, easy seated position. This one is, again, where because we see the same coloring bars that come across, and people are like, oh yeah, I have symptoms in all of these areas that are lighting up. And it also can show us how well, like your core, is it stable? Is it supporting above and below? So that's more of the structural imaging that the scan can do.
Is that similar where you use a roller?
So that one, because it's going off of electrical impulse, it's a little like 3-pronged metal.
Almost like an
device.
electrode type deal thing.
Yeah.
Sure.
You don't feel anything, right?
No, it's cold. Everyone's like, oh,
Yeah, it's chilly.
If that's the most amount of discomfort,
It's so true.
It is, right?
Yes.
It's not very intimidating.
Yeah. Well, and what's cool with these scans too is we do these all the way from infant all the way up. So as we're like the rolling thermal, we explain to kids, oh, you're going to feel like I'm driving a Hot Wheels up your spine. So, it's kind of cool. And then the kids are always, oh, it's cold.
Or tickly.
For the second one, tickly very
Yes.
much. Yep.
Yes.
Yep. But then the third scan is called HRV. That one's going through our heart rate. So it's detecting the intensity, the frequency of that beat, and it overall is giving us how well your body handles stress. So it takes 2 big readings into account, both your autonomic activity, which is kind of our energy efficiency of how the body efficiently can run on an everyday basis. And that's a big one for our moms, because typically, as we know, as ourselves are moms, that we run low on energy very frequently in our lives. So that one's a really great one to show, are we burning oil or are we using our energy efficiently? And then the other piece of it is balance. And this is a big one when it comes to neurological chiropractic, because if we're out of balance within our nervous system, we're going to live life on what's called our gas pedal, which most people know sympathetic is fight or flight. A lot of people have heard that phrase. But the opposite side of that of our nervous system is called the parasympathetic, which is our brake pedal, which is our calm zone. When we're taking a resting heart rate with this scan, we want to see people in that calm zone. And a lot of times with the stressors of everyday life, we find them in sympathetic mode, meaning that even at a resting heart rate, which we take for a full 3 minutes, they're still riding in an overdrive.
So based on what their heart rate is, their resting heart rate is for 3 minutes, is it kind of like, if you're between this number and this number, this is kind of telling us this information? Is that how you're kind of decoding that?
So the algorithm behind the scan itself is very complex that I have absolutely no idea how they do it. But because when it takes the heartbeat, absolutely, and that's where it gets the information, but it's also being able to detect, because it's through your fingertips. It's not just taking a pulse. So through the fingertips, it's able to tell us how intense and frequent that beat, and that tells us how well your numbers are showing both the energy and the heart rate. So what it looks like on the scan that we're looking at is very different than the other two scans. It's actually giving us a target, and it gives us your little white box is Abbie on the scan. And depending on where those numbers come out, we want those numbers to look 80 to 100 is our goal target zone. So obviously not a heart rate, because our heart rate goal would be more around the 60 to 65, 70. And if you're out of that 80 to 100, you're out of that, like if you're throwing darts, you're out of that middle target zone. And then you're starting to fray away from that centerpiece. And then we talk about that with our clients of why that's happening.
How often do you rescan? Because I think about if I came in as a new patient and you did these scans on me, and then the next night, that night or the next night, I went home and we just had like a really stressful night for whatever reason. And I came in like 2 days later. I mean, I could be through the roof stress-wise, and so I'm assuming you don't scan every time somebody comes in, but how often do you rerun those scans and do kind of a check-in?
Mm-hmm. Usually about every 12 visits.
Yep.
And depending on how fast that happens, right? Usually with like our babies, if there's more going on, just because it's stressful, right? If your baby's colicky or they're not sleeping or they're not eating well, then they come in for care more often. So maybe they're coming in twice a week, 3 times a week. So they'll hit those 12 visits, right? A lot faster than maybe someone who doesn't have as much going on. They don't need so much care, so much like acute care right away. So maybe it takes them 6 weeks, right, to get through 12 visits, just however long that is. But usually 12 adjustments is a pretty good amount of time to get to see changes in the nervous system. You don't want to do it too fast, because there's not enough time, right? It's kind of just like going to the gym and lifting weights. Like, you're not going to build biceps in a week. It's going to take time to do that. And same with the nervous system too. It takes time to make those changes.
Well, and obviously you guys don't just like, hey, sit down and do these scans. You take an entire history on them, right? So like you're thinking about their exercise, their age, how much they move, their diet, those types of things too,
Absolutely.
right?
Yeah, and we can tie that all into the scans too.
Yeah,
when
absolutely.
we've taken the history before that, see the scans, then we can tie in all those other lifestyle factors and be like, this might be why your scan looks like this too.
Mm-hmm. What's really cool with transitioning our practice with bringing in these scans prior to using them, our conversations with our clients, of course, can only be so much that they'll give us, which you can get a lot of great information, but you have to kind of pull that information out of them, either with the paperwork or with our conversations during that history intake. But what I've found a lot with our practice now that we have these scans, people are more willing to open up and talk a lot more about those heavy stressors, because it's showing on the paper.
It's literally there.
Yeah. They can't fake it.
Yeah.
Right? So it's really helped our doctorship with them to be able to like truly come together to create a great care plan that can truly help them where they're at versus the fake it to make it. Because no one wants to admit all of the things that are going on in their life, but if
that's so true.
Or
your
they might not
scans are
even
showing
realize it either.
It's so true. Absolutely. And that can be your nervous system talking.
Yeah.
Yeah.
Yeah. I think people normalize not feeling good or whatever for so long that it just doesn't, it doesn't bother them. But then when it shows up on a scan, they're like, what?
Yeah.
Yeah.
Well, it makes them even self-reflect a little deeper.
yeah.
Like, what? Oh, yes, actually, that has been really bothering me. And, I wouldn't have verbalized it necessarily. Or like you said, even at like a first visit, they don't know you. They're not ready to share their life story.
Right.
What about x-rays? Some chiropractic offices do x-rays, some don't. Tell us a little bit about why you don't do them, or when they're important or when they're not.
Yeah.
I think it's just the way you practice is if it's important or not. because we've like thrown the words around, right? Like neurological, like nervous system. Taking an x-ray, like you're never going to see any of the stuff that we truly care about and talk about with our patients. So for us, it would almost be a waste of time. But I know a lot of other chiropractors that when you think chiropractic, they're more like you're joint focused, right? Or maybe they focus more on athletes or things like that. X-rays might come in really handy for them,
Right.
To see, the curvature of the spine or whatever other things they're looking for.
So it's more so based on their approach?
I think so.
Yeah,
Yes, their approach
absolutely.
and how they practice. Then you either want X-rays or you don't.
I actually had my chiropractor, because I have my shoulder up here is like, sometimes it just gets solid. Like this is a stress spot on my shoulder. And so she was like, I just want to have you go. So she had me go to a different chiropractor who had x-ray. Cause she's like, is this a structure issue or is it something that can be, adjusted at some point if you ever relax that thing? And so I did end up going to get that x-ray done and just to see if there was a structure bone issue versus, muscle and stuff like that. So I think that was helpful.
Yeah, absolutely. And I'm glad you brought that up because that's part of our history intake, if something's not responding and say, okay, well, we do need to potentially dig deeper. Or if in that history intake, it's like, yeah, you might have something actually structurally happening too. We're not afraid to send them out to someone that we trust that would be a good source for those types of imaging that they needed.
And that's nice that you have that ability to be like, okay, this isn't a normal thing that we need, but if we do need it for a specific person, like we have a place we can send you to get that information and then continue your care. What about just as, in our first episode, we talked about you guys just being moms and business owners and all that stuff. And we all as humans have a lot of stress in our lives. What are your top tips for managing or decreasing stress in general? So obviously chiropractic is number one, but do you have anything else just like within your home or sleep or like anything specific about helping people to decrease their stress?
Yeah. What do you tell your patients?
Oh, well, where do we start?
Yeah, right.
I feel like we talk about this with every patient.
We do.
We're always talking. Essential oils is a fun one. We actually carry those in our office. So we use a brand called Plant Therapy, which is amazing.
I like that one.
Yeah. And they're like nice for the wallet too. Sometimes they can get pricey,
It can.
But there are certain essential oils that aromatherapy, right, helps trigger certain areas in your brain to help kind of promote like relaxation and everything. So I think we even have some called like stress relief, like tension relief,
Relax,
calming the
tranquil.
baby. Yes, relax, tranquil. Yeah, we've got a lot of those. So we love to tell people either we have them in rollers. So sometimes like rolling it right onto the skin can be helpful, but even just diffusing it in your house.
Putting them in baths.
Putting baths.
Yeah. So kind of incorporating it into other self-cares or other ways of decreasing. Because, we talk Epsom salt baths. We talk about, relying on your other tribe, your other practitioners, doing your self-care massage and going and getting acupuncture and a lot of other pieces, taking care of your body, exercise. All those things can help so much with stress and helping your body just bring that adaptation.
Well, and it's probably very individualized too, because if somebody's, needing dry needling or needing something else, it's kind of like you can help them with those different kinds of aspects or refer them out when needed too.
Right. Yeah.
This was really helpful for us to kind of be able to ask deeper questions into what the scans actually do and how they work. Because I think sometimes when people are coming in, it's just, I'm sure you do a great job of explaining what they are, but to be able to like sit and marinate on it a little bit and be like, oh, wow, there's so much value behind these. And so all three scans together, you kind of call that your like neurological scan package. Is that right? Like all three of them together?
Yep.
Now for our listeners, they are offering a special deal for you guys for a discounted neurological scan. So getting all three of those scans done. Normally it's $175. They're going to drop it down to $95 if you mention this podcast. So if somebody wants to take advantage of that, how would they get in contact with you?
Yeah, give us a call. You can find us on our social medias. You can Instagram, Facebook. You can direct message us. But yeah, during our office hours, we're always on the phone. So you can always give us a ring. You can book online. And then it's just as long as you're mentioning the podcast in person to us, that's great. We'll honor.
Yeah. What's your website again?
InspireFamilyChiropractic.com.
Awesome. Thank you so much, ladies. This was really insightful and we really appreciate you being here.
Thank you.
Thank you.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, And our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.